Secondly, our objectives really are to talk about quality improvement and the difference between that and quality assurance, as well as the integrated assessment tool, which we're going to spend our time on today, and we'll do a live demo to show you that tool. Its ultimate interest is in trying to help you to identify your strengths and areas that you might work on and how you might go about doing those. So here is the two people that will be presenting today. So Laura Trottier is one of our quality improvement coaches, hails out of North Bay, and myself, the Director of Quality Improvement at AMHO here in Toronto. So just to put some context around, so E-QIP is about 3.5 years old now, and we've been very fortunate to work with, in a partnership with Addictions and Mental Health Ontario and the Canadian Mental Health Association Ontario Division to increase capacity and capability to do quality improvement across our province with the mental health, community mental health and addiction sector. And most importantly, we have a close partnership with Health Quality Ontario, soon to be Ontario Health, as well as our new partner as the Provincial System Support Program, affectionately known as PSSP at CAMH. And our work really is to identify some indicators to help us to think about how we report perceptions of care to that clients are receiving our services, as well as increase our data literacy so that not only can we get information from the data and the reports, but also to make sure that we're using that data to improve the services for clients, and then to talk about that important work that we're doing and the spreading those findings so that we can support others across the province who are doing similar work to us. So most of you will be familiar with the model for improvement, which is on the left-hand side, which really is about figuring out what we want to accomplish based on that data, how we'll know a change has actually occurred, and then testing out some new change ideas, thinking differently about an old problem and how we might do it differently with a PDSA cycle. The domains of quality are in the center, and those are sort of internationally recognized. And then the quadruple aim, which really is improving the patient experience, their outcomes, lowering the costs where that's applicable, but also having the provider of the service have a positive experience. And if providers are enjoying the work they do, you know the clients are also going to have a more positive experience. So what does quality improvement readiness have to do with any of your work? So I'm just going to move this over to the side a little bit. So really what it is, why this is relevant for you is in our new world with Ontario Health teams, part of what we will be doing is working with others, collaborating with others to wrap services around the client group that we're honored to work with, but also measuring some of those outcomes and improving those outcomes as well as the perception of care for clients. So this is an important piece of work. All of us need to be involved in this, and part of the reason that we come to work is not just to provide service, but it's also to improve the services that we're providing to others. Just a definition of quality improvement, and we're happy to share our slides afterwards with you, so you can have a closer look at that. But it really is looking through a client lens to make things better for them and understanding what their needs are and how we can make services better for them. Just a quick piece around, there's often a confusion between quality control and quality improvement. And quality control really, where you might think about that is accreditation standards or other standards where you're measuring your compliance based on a standard of expected behavior or expected outcomes. It really is more to do with inspection. It can be defensive, and few people are required to be involved in that, whereas quality improvement is really about improving beyond those standards, creating new ways or better ways of meeting the needs. It really is about prevention, very proactive, involves all, and its scope is client care, making the experience for the client better. And Laura, are you able, can we hear you yet, Laura? You can hear us.
Yes, I think you can.
Okay, perfect. You'll let me know when it's your turn to take over. Yes, please?
Of course.
Okay. So performance measurement and quality improvement, pretty important parts of what it is you're going to be doing in the future of Ontario Health Teams, as well as your ongoing work right now. And quality improvement is really about, it's different than performance measurement. So we use different measures and data to make decisions about if we've made things better, but it really is about trying to move that bar so that the client experience is better than it was before you started your work. So some of those change ideas we put in place, how we make that even better for the client. And performance measure, it tends to be those things that we are required to present to our funders, to our colleagues about the number of groups that we're offering or the people that we're seeing and whether or not there's any changes in those. Whereas quality improvement is taking that next step of looking at that data, how it is we're doing, and how could we be doing this differently or better. So just a nice slide that speaks to the differences between quality improvement and performance measurement and their aim, which I've spoken a little bit about. It is about sample size. In quality improvement, it's just enough sample size. We don't need to do large groups. Whereas in performance measurement, we're working towards getting 100% of the relevant data. We have things that we think we want to change. We come up with a problem in quality improvement, and these are our hopes and aspirations of how we will make that better. We test it in sequential steps with a PDSA cycle, whereas in performance measurement, it's actual. That's what it is we achieved. There's no tests that are associated with that. In performance measurement, there's no focus on change, whereas we are very focused on change and quality improvement. And ultimately, with performance measurement, it's often data that's available for the public, for our clients to know about, for the ministry and our funders to know about, whereas the data with quality improvement, more times than not, and hopefully the people that we are trying to improve the services for know that we're doing that, and we're hearing loud and clear from them how it is we can make things better. So the readiness assessment and preparing for change. So part of what we encourage agencies. Oh, is that you?
Yeah, if that's okay, I'll slide in here.
Yep, perfect.
Thanks, Debbie. And so when we think about where we're going to start when it comes to quality improvement in our organization, sometimes we struggle with that. And this slide just suggests that you may want to look at a way of starting by looking at your organization through a lens of honesty and objectivity, and assess the current culture that you have at your organization and your commitment to improving the quality of care and services. And as well, understanding your organization's strengths and where there are opportunities for improvement. And that comes through looking at it, at your organization through that lens of honesty. And QI is a good starting point to assess your readiness for change, because through QI work, you are endeavoring to improve and incorporating some change ideas. And whether you're ready for that or not, doing an assessment can be helpful to identify those key areas for ensuring that the work that you do around change, that you are able to sustain that. Next slide, please. And so through that assessment, you will then prepare yourself for success when it comes to any change that you implement. And some of those fundamental traits of success related to change are around these 5 bullet points here. The first one being organizational commitment to quality improvement. The second one is leadership knowledge of QI principles, methodologies, and change management. And communication channels between leadership, staff, and teams are effective and functional. And then you have the framework around team. And then you have also another factor being that the QI initiative that you are working on is understood and is directly related to client outcome. Next slide, please. So I'll just pause here for a moment. I personally cannot see the group chat, but if there are any questions, please feel free to type them in, and we will moderate that chat box as we move through. Next slide, please. So assessing QI success and sustainability, there are two levels that you may want to look at when you're assessing your own organization. So at the organization overall, you may want to assess, and as well at the team level, so at the actual project team level. And this QI assessment that we will introduce to you over the next few slides takes into consideration both levels. Next slide, please. And we wanted to give you some background related to why we have put this integrated tool together. So our previous webinar was related to the data assessment. And if you have an opportunity, if you haven't already seen that webinar, it is recorded and up on our YouTube channel. And we would encourage you to take a look at that as well, as it is part of this integrated tool. In the past, we have used tools independently. So the sustainability tool adopted from NHS, the QI assessment tool, which is the one that we're going to be speaking about today, which was adapted from the music, the NHS sustainability, and the HAI assessment tool. And then we didn't have a formal assessment for the data, and we created and adapted some tools to create our own. Next slide. And so this is what the tool looks like. This is, we've created a tool that incorporated the three. And this assessment, integrated assessment tool has three different tools in it, and it can be filled out pre and post project, and then also kind of along the way, along the continuum of your project. And it's completed in combination with your executive sponsor, the project leads, improvement advisors, and other team members. And they're completed independently, and then the group is brought together to discuss and reach a consensus around their assessment. And then it just helps you analyze and identify any of those blind spots and strengths. And then the next slide in there was, it's a roadmap from assessment into action. So I'll walk you through the particular piece around the QI readiness assessment. So what you'll see is on that particular tab, the organizational leadership section, data metrics, motivation, alignment, and resources. And it gives you an opportunity to read the statement associated with that and then score your organization from not sure through to strongly agree. And then it populates a score. And then you move on to the next section, which is the next slide. Which is related to team project setup. So this is where it gets more granular to the work of boots on the ground work, and talking about the setting up of your project. So looking at your the QI team proper and the different roles and where they come from and the scope of the project. Talking about clinical partnership, making sure that you have that expertise at the table. Also looking at your staff, their staff capability for QI, the team members' capability for QI, and what you need to do there and where you see yourself, and then scoring yourself there. And then moving on to the next slide, we would then be looking at the team project and change ideas and the things that you need to kind of have your eye on and where you fit in that scoring Likert there. And then once you've completed all of that, then there would be the summary of your scores. The next slide, please. And on that summary page, so you'll see there's a pre and a post. And of course, you wouldn't have the post scores until after your project was end of your project. And so you would then be just looking at the pre-scores. And then it would give you, at the bottom, you see on the screen there, your keep an eye on something that would be over on the left. And in the middle, you may have a score there related to your outcome saying, keep aiming higher. So there's a bit of work to be done there. And then, of course, celebrating the work that you have done that you are doing well at. So it kind of gives you a sense of where your team is at. It identifies your strengths and areas to work on. And also, as a post measure, provides an opportunity to see whether the past work, investment, and effort are paying off, and gives you that reason, again, to celebrate. Next slide, please. And so if we could just pull up the Excel spreadsheet, I will do a little bit of a live demo here. Thank you so much. And so at the bottom, you'll notice the 7 tabs. So we have the guidelines, which gives you the instructions, your pre-assessment, your post-assessment tab, your summary, and your action and our plan. And if you wanted to just randomly pick some of those selections under the QI assessment. So, and do I have access to the mouse? Oh, can I? Yeah. So as we move through the tool, we can make some selections. And I'm just doing random. I'm not thinking about anything particular. Of course, this was, as you complete this, you would want to have a conversation first with yourself around what you observe in your organization, and then as you come together to share your results and have a conversation about each of these domains, you would want to then have a conversation about each of these specifically, and then create your own consensus summary of this assessment, and have your collective results reflected on the summary page. And I just wanted to do this because I would like to demonstrate what the summary page looks like. And so we didn't score low on the keeping an eye on anything, but we have a keep aiming higher section that we may want to take a look at. And so if you look at the scores here, the 2s are the keep aiming higher, and those are the ones that you may want to take a look at related to your project and your organization as a whole. And this is how it would then be plotted on the graph below. So as a conversation piece, it might be helpful. And as well, when you're looking at the pre and the post assessment, you can see, you know, where you might see a change, or hopefully see a change in the action section here. On the Actions tab, under the QI assessment, we would then take a look at those areas that you're wanting to improve upon, and then find the related cell in this Action tab, and have a discussion around how you might want to apply some of the ideas that we have come up with in here around what you may want to use as opportunities for improvement. And then take that information and that conversation and then plot it across the assessment action plan area here. And so if you've looked at your score, you can have a drop down. There's a drop down here that says, is there action needed here? We'll say yes. What are our action items? And then you would populate that action item. And then what priority is it? Urgent? Is it normal or low? Who is responsible for that? By what date? and then doing a follow-up. So give yourself a 2-month follow-up perhaps, and then next steps after the follow-up, then to the 6-month, and then the next steps after that. And then you can develop a plan related to that. Okay, so back to the slide deck if we could, please. And I'll give the mouse control back. Thank you so much. Great.
Okay.
So I've already covered off on the QI readiness action slide. And then I also believe that we've covered off on the next slide. So I kind of got ahead of myself in the demo. If we go to the next slide. Yes, and I just wanted to highlight here that we are going to want to make sure that when we're developing our plan that we use SMART goals as a way to articulate and then track our changes as well and incorporate those ideas into our actual project. The next slide. So the integrated DQS assessment tool, as we have dubbed it here, it's just really about gaining knowledge, having an attitude around change, and practicing by way of this work, and using the assessment as a way to explore the different aspects of your organization in a structured way. And again, it highlights those blind spots, but identifies those advantages that should be kept. It helps to prioritize your next steps and also gives you some recommendations on how to approach those next steps. It's also an opportunity to assess whether there is a culture and capacity to implement improvement and if it's going to sustain the work that you have done. The next slide, I believe, is Deb.
Okay. So thanks everyone for listening and being a part of this. We'd like to open it up to questions, and I'm just wondering if I can unmute you at all. So I have unmuted people if there's anybody with some questions. None at the moment. Okay. So just to take a couple minutes to talk about some additional resources that we have available for you to use from E-QIP. And again, these are all free and available for you to use. So most importantly, we have the last stage of this assessment tool, the 3-parter on sustainability assessment. We found this to be very useful for agencies to do as they're beginning some quality improvement work, because it helps to figure out what do we need to put in place in order to maintain our success as we start to make those changes. And so it's a great way of looking at both process, staff, and organizations, specifically around your program, and thinking about what might be the next steps in order to ensure, once you've started your quality improvement, that you're able to maintain it. So the registration link is there. This is on November 7th from 12 to 1:15, and we would welcome anyone to attend that event or that webinar as well. We have a series of quick webinars that we've done and had a lot of fun doing these. They take each of the stages of the model for improvement, and in about 18 or 23 minutes, they walk you through how it is you would apply each of those. So whether it's setting up a problem statement or doing your diagnostics or coming up with change ideas. And so it's a great way of reminding yourself about these different parts of the model for improvement, and or to specifically learn about those particular areas. Just gonna getting a bit of background noise, so just fix that. So this is our webinar series, and not every webinar is here, but we do have a YouTube channel, which is kind of exciting. And Ash has pulled this together in some of our really, they're all very useful, of course, but these are some of the highlights. So the first one is around diagnostics, and our quick webinar series is there, driver diagrams, PDSA cycles. The next one is around the data and culture assessment. The third one on your left-hand side is around evidence-based co-design, which is a very popular webinar, and it really walks you through step-by-step how to include client and family voices in the work that you're doing and understanding your quality improvement. Enhancing, I'm not sure if that says there. I'll click that. So enhancing joy in work, which was another very popular one, and it speaks about the importance of having a positive work environment for the team. Mythbusters, gosh, that was a tough word for me. A primer on governance and leadership, and we do have a governance and leadership, which we'll mention coming up shortly. Then we have a series of Cohort 2 and Cohort 3 report backs and some pretty exciting presentations and outcomes that they achieved in working with the E-QIP project, and then sustaining your gains and how you do that spread as well. Just in terms of programming that's coming up, so we do have an ideas program that we do, which is really a day-long experiential learning all about quality improvement and applying either your situation or a case study to each of the stages of the model for improvement. So people emerge from that not only energized with understanding what quality improvement and the model for improvement is all about, but also if they bring their own example with some beginning work on how to get started when they get back to their organization. We have another one coming up on November the 18th here in Toronto at the DoubleTree, a full day on the Monday the 18th, and we'll send out that link to you as well. We have a little bit more room for people to join and would welcome anybody to be attending that. We also have a newsletter that comes out regularly, and here's the link to make sure if you're not already on our newsletter mailing list, we would love for you to do that. You would be joining over 800 people in being part of that newsletter. And there are two newsletters coming out today and tomorrow. AMHO's newsletter comes out today, and then CMHA newsletter comes out on Friday, again announcing some exciting work that we have coming forward, including some supportive housing OPOC work. Here's our tweet, our hashtag, and so we would love to tweet back and forth with you, so please use that if you are a tweeter. And I'm new still at that, but I almost have 100 followers, so I'm pretty excited about more than me. Yeah, getting on there. The community practice is a fabulous place to pose a question, to ask people about something that you might like to know about, but also to get access to all of our resources. So the fishbone template is there, the problem statement is there, all of the different components of the model for improvement are all at your fingertips, the Pareto chart to work on. So if you're interested in doing some of those diagnostics or coming up with some change ideas, it's a great place to go, not only to pose a question, to see if someone else is doing similar work to you, but also to be able to get access to the resources that we have available. Just a reminder for those who are doing OCAN, there is a new version, 3.0, and if you are using it, it's important to get your upgrade to the 3.0, which focuses a little bit more on client experience, the value of OCAN in supporting client recovery, and aligning the current terminology. So it's now out there. So if you're using OCAN with your clients and don't have the OCAN 3.0, there's information there on how to get in touch with them to make sure you've got that. And then just the last piece is just contact information for us. So I'll open it again to see if there's any questions. And I've unmuted people. If you have a question you want to say it out loud, we're happy to do that. Laura's just asking if we can add pieces on right now. So let me get this one. Let's see. Okay, so we've added both of those files. Oh, that one didn't come. Just try adding that one again. So you have to put your own answers in there, not the answers that Laura put in.
It may be, the file size might be too big, perhaps.
Okay.
So we can send it as an attachment in the follow-up email to this webinar.
Okay, so hopefully you've heard all that. So those are there now, and are there, I'm just going to check the chat if there's any further questions from anyone. Okay, so a bit of found time then, and thank you very much for joining us today to talk about the integrated assessment tool that we're using and are very excited about beginning to use. And happy Halloween to those who celebrate, and safe journey home, and hopefully it's a better night than they were anticipating earlier. All right, without any other further questions, thanks so much everyone, and bye for now.